Hello again. This is Catherine Kitson, and I am one of the nurses here at Cardiac and Pulmonary Rehab. Today we are going to continue to talk about medications for my heart health. First, we're going to discuss anticoagulants and blood thinning agents. So anticoagulants and blood thinners. When we think of blood thinning agents, the goal is to prevent clots from forming, which could cause more blockages, another heart attack, or stroke. Some may have clots currently, and this medication is used to prevent them from getting larger or reoccurring. Blood thinners are also indicated for people with AFib or an irregular heartbeat, heart failure, people who have had a heart attack, or pulmonary thrombosis, or a deep vein thrombosis, also known as a DVT, which is a blood clot in the leg. The importance of these medications is in AFib, for example. The heart is not pumping properly, and therefore blood can pool at the bottom of your heart, which could cause backup and clotting, just like a sink pipe. Something important to note is these blood thinning agents have drug interactions with supplements because many herbal products have a blood thinning property. So always touch base with your providers to verify these medications can be taken together. Some popular examples are turmeric or ginseng. What to expect if you're going to bleed and bruise more easily? Obviously, blood thinners can increase your risk of bruising or bleeding more than usual, and therefore it is important to know what is normal versus not normal. So if I'm going to start on a blood thinner, what should I expect? Anyone who starts on a blood thinner will likely experience increased bruising and bleeding, and this is a normal side effect. Over time, many notice these symptoms improve. However, I just want to educate that bleeding is still a risk. The reason this happens so easily now is the medication actually blocks those clotting factors, which allows easier bleeding and bruising. It is important to keep an eye on these bruises to make sure that they get better over time and do not worsen. Sensitive tissues such as the inside of your nose or gums are more at risk for bleeding as they are very vascular areas. Having more quote-unquote pink in the sink when brushing their teeth is normal. If you rinse and spit and notice some bleeding, that is okay. Just continue to monitor areas in the mouth for bleeding and that it does not persist throughout the day. If it does persist, you just want to call your doctor. When getting nosebleeds, which is heightened during allergy season or cold season, make sure you remain calm if experiencing a nosebleed and sit upright. The common misconception to tilt your head back and pinch your nose. This will not stop the bleeding any faster, and the blood can actually move down your throat into your stomach and make you feel sick. Usually nosebleeds are short in duration. However, if it does persist, you would want to call your doctor. Just to put into perspective, if you're on a blood thinner, bleeding will last longer than if you were on if you are on a blood thinner, bleeding will last longer than if you weren't on a blood thinner. So if you are shaving or get a paper cut, etc., it could take up to double the time to stop bleeding. Medical emergency and signs of internal bleeding. So these three signs of internal bleeding are very rare and probably not going to happen to you, but it is just important to be aware of these signs. First is blood in the stool, which can show as dark black tarry stool. This means there is a bleed going on somewhere inside the intestines, which mixes in and goes through your digestive tract and comes out dark black. Some may experience bright red blood in stool, which is actually less concerning to doctors because this is a sign of external source of bleeding, such as a hemorrhoid. Another sign of internal bleeding could be blood and vomit, which doesn't appear as bright red, but coffee ground in color. It is black and gritty in appearance, which is alarming and you would want to call 911. Lastly is blood in the urine, which has a pink or brown color to it and is persistent. Some of you may be thinking, hey, I know some foods or medications I take that can cause my stool or urine to turn colors, and this is true, such as beets usually make patients' urines turn red, and iron and Pepto-Bismol can cause dark stools. So it is important to know what your individual normal is, and if something appears out of the norm, you either call 911 or your cardiologist if you are concerned and it is not an emergency. Again, these symptoms are very rare, but it is important to be aware in case this does happen so you can take the appropriate steps. So, anticoagulants. As mentioned before, anticoagulant blocks the clotting cascade to prevent dangerous blood clots in the body. These medications also assist to keep blood from pooling in the bottom of their heart and blood vessels. This can be seen in AFib, where blood pools in the bottom of the heart from inadequate pumping, or DVT, also known as deep vein thrombosis, in the leg, or pulmonary embolism, in the lung. Most commonly prescribed anticoagulants are warfarin or Coumadin, Eliquis, Xarelto, and Pradaxa. On warfarin, also known as Coumadin. It has been around for a very long time. It is used to block the effects of vitamin K in your body, which help to form blood clots. This medication requires close lab monitoring of the INR to appropriately prescribe dosing to patients. INR lab values monitors the effectiveness of the blood thinning agent, and usually cardiologists want your INR levels somewhere between 2 and 3. It is important to take this medication at the same time every day, typically in the afternoon, as consistency is key. When taking this medication, it is important to monitor your diet and other medications or supplements taken. Too much vitamin K in foods such as spinach, cabbage, or liver can cause an increase in your INR value, which shows the foods are reversing the effects of Coumadin in your body. Therefore, it is important to eat consistent amounts of vitamin K foods in your diet. Are direct-acting oral anticoagulants. Direct meaning it will work directly on the clotting factor and is not affected by vitamin K. These medications don't require blood draws or dietary restrictions. Examples of these are Eliquis, Xarelto, and Pradaxa. It is important to know that although these medications aren't affected by vitamin K, some herbal products have their own blood thinning ability, which if taken together can increase your bleeding and bruising. Switching over to antiplatelet agents. These are similar where they work on preventing clots, however they are working specifically on your platelets. Platelets are the sticky part of the blood, and they like to travel to parts of the blood where they are not familiar with and stick on them. So, after someone has had a heart event and a stent is placed, platelets will travel to the stent and stick to it, seeing it as an unknown foreign object. Obviously, we do not want this to happen because it can cause clots and backup of proper blood flow. With that being said, it is so important to take these medications because we are trying to prevent a secondary event. We are trying to keep the stents patent and open with blood flowing freely through. Examples of these types of medications are aspirin, Plavix, Effient, or Brilinta. Some of you may be curious, do I need to take these medications lifelong? This is really determined by your cardiologist, but frequently they have you take it for at least 6 months to a year post-event and then stop. The reason for this is your body accepts the stents as their own and does not see it as foreign, and therefore the platelets do not stick to them. So when taking these blood thinning agents, you want to avoid non-steroidal anti-inflammatory drugs or NSAIDs. It's important because these medications such as ibuprofen or Aleve can actually prevent aspirin from working effectively. And if you are taking these medications consistently long-term, they can cause an increase of bleeding and ulcers, which in turn can make the heart work harder than it should and increase your blood pressure. These medications are also eliminated through the kidneys, so it can actually cause or worsen kidney disease. There is other options to consider for pain, such as Tylenol. However, Tylenol does not really touch inflammation, so there are topical forms of medications such as Voltaren to use that are not absorbed through the body and therefore does not cause worsening kidney, intestine, or heart disease. So somebody may be taking diuretics or water pills, and these assist to balance the fluid in the body for patients with congestive heart failure, to reduce buildup of fluid, which could cause an exacerbation. So symptoms of heart failure are weight gain, shortness of breath, leg or abdominal swelling. Diuretics are also used to control blood pressure. The most commonly prescribed are Lasix, Bumex, or Spirolactone. Some of these medications are more potent than others, and your cardiologist will prescribe one that is specific for you and your symptoms. Anti-arrhythmia agents. These are used for irregular heart rhythms such as AFib. These agents are used for rhythm control and rate control as well. Examples of these include Sotalol or Tecousin. Some of these medications also require close monitoring when they are first started, and therefore your cardiologist will have a plan of action for that if you ever need these medications. This concludes part 2 of medications, and I know it is a lot of information, so please don't hesitate to reach out with any questions. And again, the pharmacist here at Cardiac Rehab is a wonderful resource to use and speak with if you have any questions as well. Your case manager can set up an appointment for you. Thank you for listening.